Welcome Gold Delegates. I'm Fleur Bickford, Program Director and MC for Gold Perinatal Online Conference 2015. I'm here today chatting with Karen Kerkhoff Gromada, who is chatting with us about her upcoming presentation titled Multiple Pregnancy and Birth, Perinatal Care, One Size Does Not Fit All. So welcome Karen, and thank you for taking this time to chat with me today.
Well, thank you for inviting me.
You are very welcome. We're excited to have you as part of our conference this year. So to start with, I'd love to have you tell us just a little bit about your professional journey as a nurse and how you became interested in perinatal care.
Well, my career goes back very far because I have a diploma in nursing that I got out of high school, and then eventually I went back and got a BSN and an MSN. I knew I wanted to work in perinatal care from the very beginning, and I couldn't even tell you why. I worked in labor and delivery initially, and I taught childbirth classes very early, and I was the nurse that they always said, this one wants an unmedicated birth, why don't you be her labor and delivery nurse? And that's how I became interested. And then, of course, I had my own children, and my twins were born at 40 and 5. And new moms today know the lingo of gestational age and the weeks and the days. So if I say 40 and 5, they know exactly what they mean, and they all gasp because all of them think full term is supposed to be 37 weeks with twins, but it's not because cooked is cooked. So at any rate, I have monozygotic MODI, and again, mothers of twins today or triplets, they all know what the lingo means. That means monoamniotic dichorionic, or I'm sorry, monochorionic diamniotic, and those often even are induced or taken earlier these days. And we're going to go into the risk factors of that when we talk about the multiple pregnancy and birth perinatal care talk. And at any rate, mine were full term, and I went into spontaneous labor. I had an unmedicated labor and birth with my twins, and the second one we thought was breech, or we know he had been breech, and the little bald rear end that came out a bald head. So he turned vertex who knows when. And they were both, one weighed 6 pounds 6 ounces, and one weighed 7 pounds 11 ounces. And so it was 14 pounds a baby. And even with the, I would say, ideal pregnancy and birth that I had, a multiple pregnancy is harder because we are essentially designed as a womb for one. We Homo sapiens are designed to have one offspring at a time, and for many reasons. And it is more of a physical and emotional stressor, I think. And much of the perinatal care today adds emotional stress to expectant mothers of multiples.
Okay, thank you for that. And you've kind of touched on my next question, but I'd love for you to just tell us a little bit about how does having a multiple pregnancy sort of change the circumstances of birth for most mothers these days. It sounds like you had quite a kind of ideal labor and delivery, but I know it's certainly not that way for everybody. And what do you kind of tend to see with the moms that you work with in terms of what their birth experience is like, and kind of how things change when they hear the news you're having twins, or triplets or more?
Well, I think what I hear today is less of the OB care provider working with an expectant mother of multiples as in a partnership. Too often, and I'm not saying there aren't those out there, but too often I hear, well, my doctor says I'm going to do this when. My doctor may allow me. My doctor, what do you mean? You're the woman who is carrying these babies. Yes, it is more physically stressing. Yes, it can be more emotionally or mentally stressful. Yes, it is higher risk simply because such ... is more likely to happen than with a singleton pregnancy, but that doesn't mean it will happen. And what can you talk to your doc? What would you like? What do you want to see for your labor and delivery? We know what kind of outcomes you want, and how can you get as close to that working with your OB care providers or changing providers if you need to? And how do you know if and when to do such a thing? Does that answer that question, kind of?
Yeah,
That's
absolutely.
about, that's probably as brief as I can be. I can go on and on.
And we look forward to hearing much more about it during your presentation for sure. So um, just tell us a little bit now about what you hope delegates are going to take away from your presentation. What do you hope the healthcare providers who are listening are going to be able to kind of take away and apply to their own practices?
Well, one, I want them to be more aware of these situations and the type of twins makes a difference, but also the type of risks that are there, or whether slightly or greatly increased, and what we're looking at, how that affects mothers emotionally, and or the expectant mothers emotionally, and provide them some tools that they can use to work with clients, or that their clients can take to their OB care providers to become more empowered to get the type of birth that they desire and the type of outcomes they desire, without the fear, without intimidation, without taking a mom's power away from her.
Okay, thank you. And of course, such an important thing to make sure that our families are leaving the hospital feeling empowered after the birth of their children. So I definitely look forward to hearing more about all of this in your presentation. And for our delegates who are listening, you will be able to hear more from Karen during her live presentation on Monday, October 26th at 1900 UTC. And of course, the recording of her presentation will be available throughout the duration of the conference.